back. Now, healthcare practitioner and psychiatrist Dr. Lerato Dikobe-Kalane is calling for the inclusion of traditional healers in tackling mental health disorders. She says most of the country's psychiatrists are in private practice, and as a result, the majority of people with mental health disorders don't have access to treatment. Now, Kalane says educating traditional healers about common mental health disorders and treatment options could make a significant impact. Well, Dr. Lerato Dikobe-Kalane joins me in studio now to discuss this. Doc, thank you very much for your time. So talk to us about the solution that you're proposing here, involvement of traditional healers in mental disorders.
Yeah, I think there needs to be a collaboration in both sectors, traditional and Western medicine, so that people can have easier access and can be diagnosed earlier. You know, especially for the more milder conditions, things like maybe anxiety disorder or a mild depressive episode, my traditional healer colleague can be able to pick that up and perhaps help on a social setup. But when it comes to the more severe psychiatric conditions like bipolar disorder or schizophrenia, my colleague would need to be educated on how to pick up on those symptoms and be able to refer to me.
Trust issues immediately come into play. Some will say that, look, we are a Christian-centered family and therefore we don't believe in traditional healing. How do you sell this, therefore, to those kinds of skeptics?
Look, when we talk about traditional medicine, we are not only talking about dingaka Sesotho kapa izangoma. We are talking about Eastern medicine. We are talking about religion itself, spirituality as a whole. So it also depends on your belief system. So if you believe in traditional medicine in the sense of Isangoma or Ngaka ya Sesotho, that would be your belief system. If you believe in spiritual healers, be it, say, in the Christian church setting, Baprofeta or like the Zion Christian Church, that is your belief system. So all those are classified as alternative medicine. Hence, you know, then under the whole umbrella of traditional medicine.
It's not the first time, and you're certainly not the first person to make this call to say traditional healers should be incorporated and seen as people who have the skills to heal people. What is the hold-up, or what's the drawback?
I think it's, to a certain extent, lack of respect and acknowledgement from both ends. As a Western practitioner, I need to respect that my traditional colleague is gifted and is a specialist in his or her field, same as I am gifted and I'm a specialist in my field, and goes both ways. So if both can have mutual respect for each other's trade, so to say, then the conversations can start and then trust can then be formed.
Severe mental illness, do you think that traditional healers can play a major role there? You spoke about mild conditions, but now severe.
The role that they would play would be in picking up that this is a severe mental condition. If they know the symptoms of schizophrenia and they know the symptoms of bipolar disorder, they would be able to say, okay, this is beyond my scope of practice. Here's a letter, go to your nearest clinic and ask them for help.
Dr. Lerato Dikobe-Kalane, this is a discussion that is going to go on for some time. Thank you very much for joining us.